Here is a detailed comparison of 15 key differences between gestational diabetes and prediabetes. 1. Definition. Gestational diabetes, GDM, a form of diabetes that is diagnosed for the first time during pregnancy. It results from the hormonal changes of pregnancy that lead to insulin resistance, causing elevated blood glucose levels. Prediabetes, a metabolic condition in which blood sugar levels are higher than normal but not high enough to be classified as type 2 diabetes. It is a warning sign indicating an increased risk of developing diabetes in the future. 2. Timing of onset. Gestational diabetes develops only during pregnancy, typically between the 24th and 28th week of gestation. Prediabetes can occur at any time in life, especially in adults who are overweight or have poor dietary and lifestyle habits. 3. Population affected. Gestational diabetes affects pregnant women only, regardless of previous diabetes status. Prediabetes can affect men, women, and children, especially those with risk factors like obesity and sedentary lifestyle. 4. Duration. Gestational diabetes is usually temporary and resolves after delivery. However, it increases the risk of type 2 diabetes later in life. Prediabetes is a chronic condition that can persist and may progress to type 2 diabetes if not managed. 5. Cause. Gestational diabetes, caused by pregnancy hormones like human placental lactogen, estrogen, and cortisol that interfere with insulin function. Prediabetes, caused by insulin resistance due to factors like genetics, obesity, lack of exercise, and poor nutrition. 6. Risk of progression to type 2 diabetes. Gestational diabetes, about 50% of women with GDM may develop type 2 diabetes within 5 to 10 years after pregnancy. Prediabetes, around 70% of people with prediabetes eventually develop type 2 diabetes without lifestyle intervention. 7. Symptoms. Gestational diabetes, often asymptomatic. Sometimes symptoms include increased thirst or frequent urination. Prediabetes, usually no symptoms. However, some may experience fatigue, blurred vision, or darkened skin in certain body areas, acanthosis nigricans. 8. Diagnosis. Gestational diabetes, diagnosed through an oral glucose tolerance test, OGTT, usually between 24 to 28 weeks of pregnancy. Prediabetes, diagnosed using one or more of the following tests: fasting blood glucose, 125 mg per liter, HbA1c, 5.7 to 6.4%, OH, 2 hour, 140 to 199 milligrams deciliters. 9. Management approach. Gestational diabetes, managed with dietary changes, regular exercise, blood glucose monitoring, and sometimes insulin or oral hypoglycemic agents like metformin. Prediabetes focuses on lifestyle changes, healthy diet, weight loss, physical activity, and sometimes medications like metformin. 10. Impact on the baby. Gestational diabetes can lead to macrosomia, large baby, birth complications, neonatal hypoglycemia, jaundice, and a higher risk of childhood obesity or diabetes. Prediabetes does not directly affect the baby unless the woman becomes pregnant and it progresses to gestational diabetes or type 2 diabetes. 11. Screening recommendations. Gestational diabetes. Universal screening for all pregnant women between 24 to 28 weeks of pregnancy. Prediabetes. Recommended screening for adults that are 35 years, overweight individuals, or those with risk factors like family history, high blood pressure, or sedentary lifestyle. 12. Hormonal influence. Gestational diabetes, heavily influenced by placental hormones that increase insulin resistance. Prediabetes, not linked to pregnancy or hormonal changes. Rather, it's related to metabolic dysfunction. 13. Use of insulin or medication. Gestational diabetes. Insulin is often used if blood sugar levels cannot be controlled by lifestyle alone. Some may use metformin or glyburide. Prediabetes. Medications like metformin may be used in high-risk individuals, but the mainstay is lifestyle modification. 14 risk factors. Gestational diabetes. Risk factors include advanced maternal age, obesity, family history of diabetes, history of GDM, and ethnicity, higher in South Asians, African Americans, etc. Prediabetes. Risk factors include obesity, age over 45, sedentary lifestyle, hypertension, poor diet, and family history of diabetes. 15. Reversibility and long-term outlook. Gestational diabetes usually resolves after delivery, but there's a lifelong increased risk for both the mother and child to develop type 2 diabetes. Prediabetes can be reversed or delayed significantly with sustained lifestyle changes, thereby preventing progression to full-blown diabetes. Thank you. Have a nice day.